I mean...
Yes, the colon, here's the cecum. It is shaped like a cone. Appendix is coming off down here. So what we're seeing is air pockets trapped within fecal material. So in the other colon that I showed you that was clean, you just saw fluid density. You didn't see any of this air and stool. So if you want to correlate it to the KUB, see the air pockets? Little tiny air pockets.
Point that out one more time.
You see little air pockets here? That's what you're seeing on the CAT scan in the ascending colon here. So that's how you know that there's a lot of fecal material, because the air is trapped in the feces.
So you have a bird's eye view here when you see people from the inside out.
Yes.
And it becomes pretty plain when they have fecal impaction and they're walking around like that.
Yes.
So what would you say to people, doctors even I've heard say, there's no such thing as impacted colon. People are not walking around full of stool.
This is a typical appearance of a person. You can grab anyone off the street and take a picture, and you're going to see the colon. If it has not been cleaned out, everybody looks like this. Every single case, unless they've been cleaned out for some reason, that I see, the patients look just like this.
And earlier we were talking about, you see people who have really, really distended bellies, and you said that they're just full. I mean, so does that person's colon, does it look healthy from an x-ray?
No, it doesn't look healthy on the x-ray. In fact, let me just go back to this other film here. In fact, what we see here is this person's pretty thin, but what we see is the sides of the abdomen will actually bulge out on either side here, bulge out. You can see the colon just falling over and spilling out, and it's just pretty impressive. And I'm just going through the images here. You can see the nice descending colon here, and it just you see it spilling out, and people end up, we see hernias daily, bowel hernias sticking through the abdominal wall because there's so much pressure in the abdomen. It just pokes right through the muscles in your abdomen, and the bowel comes right out and right outside. We see hernias a lot. That's another problem of an impacted bowel and no bowel care or herniations.
So when you're walking down the street just to the grocery store or whatever you're doing in your daily life, and you see, let's say it's a man, it could very well be a woman, doesn't matter the age, but with that very large stomach, and sometimes even where you can tell that they're thin sort of elsewhere, it seems to be very localized. What runs through your mind?
Well, when I see that, I know they have bowel issues, because the abdomen, everything is stretched, and it has nowhere to go but out. And if we look at CAT scan on these people, not only do we see the bowel all over the place, we see a lot of fat in what we call the peritoneal space, and all that is just the space between the bowel. This person has some fat in there. It's normal, you should have some, but you know that that person just has it all over the abdomen.
Yeah. So that distension that you see that people have, it's alarming a little bit.
Alarming, yeah.
They should be worried.
They say beer belly. It's not a beer belly. The colon is backed up. They do have a lot of fat in there, but it's the colon.